Hi friends, if you are looking out for zygomatic dental implants, conventional implants, basal dental implant, then I have come up with one beautiful case presentation of Mr. Peter, where all these implants have been done for him to satisfy him and get him the fixed teeth in just 3 to 5 days time. Not wasting any time, let me quickly show you the case of Mr. Peter. He is 59 years old, and as you see on the screen, his face has totally collapsed. If you look from, this is the side view. From the front view, you see he is not having any teeth in the mouth, he is not able to smile. And if you look on the left side bottom, there are only few teeth, and on the upper there are no teeth at all. So he is not able to chew. And what we did, like for every patient for evaluation, we did the 2D OPG X-ray. Now luckily for me, this 2D OPG X-ray is enough, so we did it, and we realized that in the upper jaw, his bone is totally collapsed, the sinuses have come down, and there is also a cyst, an infection in the upper jaw. Lower jaw, I can say the teeth were fine, but to do the better evaluation, we then did the CBCT 3D X-ray. Now like you are seeing on my screen, this CBCT 3D X-ray, we are able to see both the zygomatic bones, okay, the nasal bone, the upper jaw and the lower jaw. Using this X-ray, we plan to place the implants in the cheekbone, this is the zygoma bone, so that we can clean up all the infection in the upper jaw and we can still give him the fixed teeth in the 3 to 5 days time period. Now with this planning, first we decided to do the lower jaw implants with the basal implants. Now with this basal implants was very straightforward case, no cut, no bone grafting, and as you see on my screen, we have put this basal implants in the lower jaw, okay, completed in half an hour, 45 minutes. Now why we did like this is to break the surgery time. Normally we don't do this, but in this case, to break the surgery time between the upper and the lower jaw, we finished the lower jaw and scheduled him for the upper jaw treatment on the next day. Now as you see on my screen, on the next day, we open up the gums and we cleaned all the infection from the upper jaw, and on the left side we placed 2 zygomatic implants. It's called quad zygoma. So because the bone was very weak, there was infection, the sinus had come down. On the left side, to avoid the sinus lift and bone grafting, we have put 2 zygomatic implants in the cheekbone, as you see on my screen. On the right side, we have placed 1 single zygomatic implant because there was bone available in this region to put the 2 regular implants. So as you see and you can appreciate, for the same patient, 2 zygomatic implants over here, 2 regular implants, 1 zygoma implants, and the lower jaw with the basal implant. So in the same patient, we have taken the advantage of all the system, conventional system, zygomatic dental implants, basal implants, because our motto is to give the best to the patients. And as you see, this kind of work can be done only by doctors who are trained in zygomatic implants, conventional as well as the basal implants. So depending on your case, we can recommend you do whatever is the best to give you the best and quick results. Otherwise, this case would have gone on and on for many years. Now you can see on the screen the healing on the day 2 is such beautiful. Lower jaw, almost the healing is complete. Upper jaw also, patient had minor pain and swelling, but which is very much under control and acceptable. Once we have made the measurements, we made this beautiful temporary provisional teeth set. Now why we make this temporary teeth set is so that the gum shrinkage can get complete, everything, the healing can get complete nicely before we switch the patient to the permanent teeth. Now this teeth we have installed on the patient on the 5th day. What I mean by that is, from the day Mr. Peter, who was not based in India, he arrived at our clinic, okay, he was based abroad, he came to my clinic. From that day, including the planning, surgery and making of the teeth, everything got completed in 5 days time. If I look from the day of surgery to the fitting of the teeth, everything got completed in 3 days time. So just on the 5th day, such a complicated case where there was no bone in the upper jaw, sinuses had come down, there is infection, we have utilized the power of all different implants, zygomatic dental implants, conventional implants, basal implants, and given what is best to the patient. In just 5 days time, patient has got the fixed teeth. As you can appreciate on the screen, the before and after images. Just see such a big space, a difference in the smile. The entire smile is looking good. He is able to eat properly, nicely enjoying his smile. And after a period of 6-8 months, whenever the healing is complete, we can simply change this temporary into the permanent prosthesis. So friend, if any one of you or your relatives or your family members, someone has told you that you have to undergo complicated sinus lift surgery, bone grafting surgery, you have to wait for your permanent teeth, or do the difficult surgeries, long waiting time, then I have given my number with this video. You feel free to WhatsApp me, contact me anytime, and I will help you in the planning of your case and how you can go about it. So please don't feel that if your bone is weak, you cannot get teeth. I personally feel everyone can get the fixed teeth with good planning, combining the help of zygomatic implant, regular implant, basal implants. Whatever is best for you, we can plan it out for you. Feel free to communicate with me. If you like this video, drop your comments in the comment box below. I will definitely reply. If you have any doubts, you can contact me. Till next time, you please share this video, pass it on to your family and friends. Till next time, thank you very much. See you soon.